Hello, and welcome to Group 3's multimedia project on crisis intervention theory, a social work perspective. Webster's dictionary defines crisis as a time of intense trouble, difficulty, or danger. In mental health terms, though, crisis is trauma that we experience which can lead us to feel threatened by the obstacle. However, this is an opportunity for social workers to encourage healthy change in our clients. It also depends on how the person reacts to the event that is occurring, which is where we can introduce crisis intervention therapy. Crisis intervention is an immediate action during a time of crisis to minimize the severe negative side effects that come along with a trauma-inducing circumstance. Crisis intervention is very time-limited. We have to work quickly for the effects to work and for the outcome to be positive. Our initial engagement to the person in crisis and the psychosocial assessment that we must take have to be simultaneous in order to preserve time. Social workers must also meet the immediate needs of the client in order to get them back to a state of typical functioning that they had before the crisis occurred. Roberts' 7-stage crisis intervention model is used for clients who are in a crisis state of mind as a consequence of a conflict, such as a divorce or broken friendship, a crisis-inducing event, such as a natural disaster or sexual assault, or a pre-existing mental health condition, such as depression or bipolar disorder. The biopsychosocial must be swift and thorough, and we must portray genuineness and respect, help the client focus on current problems, encourage the client to express and vent their feelings, create a plan of action, put that plan into action, and follow up with each client. Some of these settings include schools, jails, and hospitals. With more school shootings, crisis intervention can be utilized more and more for the children, adolescents, and teachers that experience these horrific acts, as well as the people who are afraid to go to school because of these situations. In hospitals, some people may experience something traumatic, such as the sudden loss of a loved one or seeing someone die. Crisis intervention can help them immediately so that they can begin to process their emotions a lot sooner. Most of these assessments are one-on-one and can last anywhere between 50 and 90 minutes. Triage assessment looks at how the cognitive, emotional, and behavioral factors have contributed to the current crisis. Triage assessment is known as look, listen, and link process following the Roberts 7 principles for crisis intervention. Along with this, it is also important for your client to feel equal to you and that you are not in any way superior to them. Crisis intervention is an equilibrium model, which means that there is a state of balance within this theory. It applies to all levels of social work and works well with diverse groups. This includes racial and spiritual backgrounds, gender, and languages across individuals, families, groups, and communities. Memphis police noticed that their officers were engaging in more forceful tactics when face-to-face with a mentally ill individual experiencing a crisis. The department realized their officers lacked the education in how to work with the mentally ill population, and due to these encounters, an increase in jail detainment occurred. Authors Robert and Ottens state in their article on the crisis intervention model, crisis intervention has now evolved into a specialty mental health field that stands on its own. Man-made and natural disasters have historically and currently continue to cause crisis in the world. Examples include Hurricane Katrina that flooded New Orleans, 9/11 in New York City, mass school shootings, and more. Crisis intervention approaches have included crisis debriefings and groups of support social services entering the location of where the disaster hit after the crisis occurred. For example, if a coworker was seriously injured or passed away while on the job, or healthcare workers experienced their patient passing away, These incidences may have and will impact the other employees who witness or were close to that individual. A crisis debriefing would be provided by the administration for employees to attend, where the focus to discuss the experience. Studies have shown when crisis debriefings occur after a crisis disaster, the individual involved feels more supported by one another and their companies, and they feel more connected emotionally, creating a plan together for the aftercare. Crisis debriefings last about an hour long. We have learned that crisis intervention practice settings are a value part of the crisis theory. Psychiatrist Kaplan stated in the book Crisis Intervention and Trauma Response, Theory and Practice, crises don't just happen to patients. It can happen and does happen to anyone at any time under the right circumstances. Also, crisis theory views the individual's function as a process rather than an illness. Crisis intervention is largely utilized in the social work setting because it can give our clients a new coping mechanism for stressors in life. Because the approach is time limited, it allows us to get a full assessment and create personalized interventions very quickly, while also gaining dual perspectives and is adaptable across many situations. This theory is also straightforward and is easy to remember and practice. Faulty assessments can take place dependent on the nature of the crisis. The social worker can become distracted by the environment or the number of individuals in crisis and can lose focus of the client at hand, causing the client's condition to possibly worsen. Social workers are also susceptible to falling into the trap of hearing the same problem repeatedly, thus providing preordained treatment without fully hearing the particular client and their needs. Overwhelmed by the situation, social workers may be unaware of their limitations in terms of energy and ability to focus, again, leading to a faulty assessment. Some social workers may use CBT, while another would provide solution-focused brief therapy when helping a client to crisis resolution. This leads to the measuring the effectiveness difficult. Crisis theory allows social workers to provide crisis care across various situations amongst diverse individuals and groups. While the flexibility of the crisis role model allows for this, there are also underlying issues which hinder the ability to assess diverse individuals and groups in crisis. Cultural differences at times are not able to be acknowledged due to the condition of the situation. Immediate engagement, assessment, and treatment is a must, leading to the worker inadvertently disregarding cultural differences and causing a strain between worker and client. In other situations, the worker's cultural incompetence causes the client to mistrust the worker. To be effective to diverse groups in crisis, theorists must actively engage in self-awareness and reflection while constantly evaluating how their prejudices affect their ability to provide proper intervention.